Okay, now we're going to look at some little tiny structures of the inner ear. This black spot, kind of horseshoe shaped right here, is the epitympanum. This white thing right here is the malleus. Okay. Little tiny thing right here on either side. We can see the facial canal. Cochlea. A little bit more visible here. That's the internal auditory canal. This black area here is the tympanic cavity. Mastoid air cells. Okay. That's the mastoid air cells. This is the temporal bone. Okay. Looking at this image here, again, the internal auditory canal. This little line here that kind of has a curve to it is the superior semicircular canal. And the one that goes off to the side is the lateral semicircular canal. The epitympanum. This little white spot right there is the incus. And then of course this long black line here is the external auditory canal. That's the part of the ear that we can actually visually see. Styloid process. Tympanic cavity. It's the oval window. Okay, these images are slightly out of order. This is the temporal bone, mastoid air cells, let's look at these little lines right in here. There's one right there. That is the semicircular canals. Jugular fossa. The hypoglossal canal. And the occipital condyle. Okay, now we're looking at axial images of the temporal bone. The mandibular condyle. That's the sphenoid sinus. The clivus. That's the carotid canal, so the carotid artery entering the brain. We noted this on the brain images. This is the sigmoid sinus. Mastoid air cells, of course. External auditory canal. Here's a continuation of the jugular foramen. the jugular vein exiting the brain. Okay. We noted this on the other image. This is the auditory ossicle, so it's the malleus. And just below it, that is what we would term, it's another auditory ossicle, it's the incus. So we just saw it as a little tiny dot on the coronal images. Okay, so here's a continuation of the carotid canal, internal auditory canal, the vestibule. Here we can see a semicircular canal. And right in here is the cochlea. Alright, continuing on in the axial images. Clearly we can see the temporal bones, or the mastoid air cells of the temporal bone. This is the patient's right side. Temporal lobe, of course. That's that superior semicircular canal that we saw so clearly on the coronal images. Mastoid antrum. Posterior semicircular canal. Sigmoid sinus. Temporal bone. Occipital bone. Okay, a whole lot of anatomy here in the neck. Maxillary bone. Oral vestibule. Masseter muscle. This is the ramus of the muscle of the mandible. So this would be the patient's left ramus, left mandibular ramus. Atlas anterior arch. The dens. The spinal cord. Okay, let's try to look real closely right here. That's the internal jugular vein. It's the mastoid tip of the temporal bone. It's the parotid gland, so that's the patient's right parotid gland. An important place for us to look for cancers and infection. With right beside it, right here, that vascular structure there is the retromandibular vein. Retromandibular vein. Bright white right here on either side. The internal carotid artery. Right there. Pharynx. Right. This is the glenoglossus muscle, so dealing with the tongue. Let's see if we can visualize this appropriately. Right here, I believe. Yes. Right there and right there. Vertebral artery. This white line right here. Vertebral spinous process. These gray spots here anterior to the vertebral body are the longest colli muscles. Okay? These muscles here are the rectus oblique capitis muscles. Okay. Looking at more muscles back here, going in this direction and in this direction, we have the splenius capitis muscle. And finally, medial to the mandibular ramus, we see the pterygoid muscle. Okay. We saw this in the last slide. This is the glenoglossus muscle. The tongue. The mandible. The pharynx. Okay. The jugular vein. Vertebral body. Right there. It's the patient's right vertebral artery. These muscles are very long for the neck muscles. They're the sternocleidoid mastoid muscles. And this right here is the submandibular gland. Now we're getting into the area of the thorax. Okay. Sternohyoid or sternothyroid muscles. These white lines right here are thyroid cartilage. Within that, there's some smaller white lines right here. That's the cricoid cartilage. We saw this on the last slide, the sternocleidoid mastoid muscles. These big structures here, any of the vascular structures are the jugular veins. Okay. Right next to it is the thyroid gland, which of course is going to have some affinity for contrast. The esophagus. Vertebral body. Erector spinae muscle. Trapezius muscle. Really clearly we can see a right vertebral artery. Highlighting very nicely because of the contrast. That's the right common carotid. Right common carotid, left common carotid, and then the pharynx. Alright, let's skip down to the level of the lumbar spine. As I mentioned, these images are somewhat out of order. These are uncontrasted, these are non-contrasted images, so the vasculature right here is not highlighting, but this is the aorta. Psoas muscles on either side of the spine. You can see the dural sac of the spinal cord. Pedicle. And counting up from the bottom, we have 5, 4, 3, 2, 1. So this is the pedicle of L2. You can maybe see it a little bit more clearly on the bone windows. Lumbar vertebra, L2. Okay. This facet joint here is the articular facet. You can see it more clearly on the soft tissue windows, but this is the ligamenta flava. That is the spinous process of L1. So dipping down, we can see it coming down into these images. That's L1 spinous process. This is the transverse process of L2. Erector spinae muscles. On either side, these soft tissue structures here are the kidneys. And this long line here is the small bowel, the jejunum, or perhaps the ileum. Okay, proceeding. This is actually the inferior vena cava. The aorta. This is the L2 vertebra, vertebral body. Psoas muscles. Within this area here, we see the dural sac. I cannot visualize it on this image, but just a second here. Yeah, here we go, sorry. L2 lamina and the L2 spinous process. Along the spinous process on either side, we have the multifidus muscle. Erector spinae muscles on either side of that. Patient's right kidney. Little dots on either side are actually exiting nerve roots. And if you can see this little change of attenuation here, this little gray line here, that is the posterior longitudinal ligament. Okay, last slide. Inferior vena cava, aorta. A little bit difficult to see here, but this is the annulus fibrosus. And then we can actually right in here see, you can see a slight change of density between here, and that is the actual intervertebral disc. So it's between L2 and L3. We can actually see we're at that level right here. Right, and if that's the case, these are articular processes. This is the L2 spinous process extending down. Erector spinae muscles. Psoas muscles. South pole of the right kidney. It's still difficult to see. or no, we can see it better right here. The ligamenta flava, dural sac of the spinal cord, and right over here, and right over here. That's the quadratus lumbrum muscle. Alright, thank you. Hopefully this was helpful.